Okay.
Lovely. Okay, welcome everyone. Hopefully more people will be added as we go. So today we've got, and hopefully I'm pronouncing this right, is Lella, did you say Lella?
Yeah, Lella.
Lella from CQC. It's going to talk to us. We've got the lovely Karen Andrews as normal from Skills for Care. And have we got Karen Large yet? I haven't seen her.
Karen will be joining in a few minutes. She's in another meeting at the moment.
And so that's about insulin management. So it should be a good session today. So Layla, if you're ready to go, then that would be great.
Great, thank you. The only problem I've got is I can see nothing on my screen. So, oh, I think I can see Christian's screen now. I couldn't see any of you. You'd all disappeared. Aha, I can see my slides now. Okay, so are you okay doing the slides, Christian? And I'll just
absolutely.
Or Joanna, whoever's doing them. So first, I have no clue how many people there are because I can't see anything other than Christian's face and the slides. So thanks for inviting me. I have been to different Register Manager Network events, but obviously not in the last 18 months. So thank you for the invite. I'm Lella Andrews. I'm the Inspection Manager for the Adult Social Care Inspection Team for CQC in Suffolk. Some of you who are on the call might know me. I might have met you. As I say, apologies, I can't see any of you or the names. So I've been working in regulation for the last 20 years. So I was an inspector for 12 years, mainly in Norfolk, sometimes in Cambridgeshire. And I've been a manager of the adult social care team for the last 9 years. And I've managed the Norfolk team, Essex, and I've been in Suffolk for a while now, 3 or 4 years. So before that, I did my training as a nurse for people with a learning disability. And I did that at Turner Village in Colchester. Some of you may know that hospital that was. And then I was a registered manager and I was a regional director before moving to regulation. So it's been a while since I've worked directly with clients, but obviously within the commission we do still do our best to keep up to date with things. So I thought it would be helpful. Christian asked me to come and talk to you a bit about how we're changing the way that we inspect and regulate. So I thought it would be helpful really to give you before that a bit of background about how the commission is moving forward, because just coincidentally nothing at all to do with the pandemic is that we're at the point where we're our 5-year business plan. Thank you, Christian, for moving on. So I don't know what you're doing to me now, Christian. So I want to say on behalf of managers and your begin to imagine about how I would have coped with that. And we know that it, and we also know, it's going to take some, what might have been, well, that's all getting used to the new normal conversation, how amazing registered that, because you probably don't hear that from us. Has it moved on for me either?
There's a gremlin to say, I think.
It's a challenge. But like you say, we're less stressed about these things now than we were, more used to them. So you're having trouble there, Christian. Okay. So I thought it would be helpful just to give you a bit of background about the whole of CQC, really, not just, and then I'll move on to adult social care. So we are working towards a kind of a new way of working, and we're changing how we regulate to improve care and services for everyone. So our purpose and our role isn't changing. So we'll still be the regulator, we'll still be working to the regulations as laid down in law, but how we're responding and how we're going to do that will be different. So regulation will be more relevant to how care is delivered. So over time, lots of different types of services have been developed that we originally weren't set up to inspect. And so we've kind of been running to catch up with some of those. And some of those, for example, might be how you've got discharge to assess beds, or which were not there a few years ago. So our new strategic direction is what I'm just going to talk to you a little bit about, and then I'll move on to adult social care. So next slide, please. Okay, so our focus is on people and community. So regulation needs to be driven by people's needs and their experiences, and focusing what's important to them. So I think what you'll see is more of us regulating in a place rather than individual settings. So we've already done some pilot work. You might have heard about provider collaboration reviews or local system reviews, and you might have been part of those. And that's where we look in terms of regulation about individual people's experiences of moving through health and social care, because actually people don't tend to just, someone in a care home is still receiving care from the GP, from the dentist, from the hospital possibly, and from a variety of community health options, mental health services as well. So it's important to look at actually how do those services all work together. So we know that sometimes when we do inspections, there's frustrations about, we can't get the GP to come out, or we can't get hospital appointments, those kind of things. And so if we're looking at care for an older person living in a care home, we need to look at their whole experience really and identify if there is an issue, where those issues are. Next slide, please. So we're looking at regulation being smarter. So that's around us being more dynamic and flexible, and that our regulation, the information that we provide on our website needs to be more up to date and to provide high quality information and ratings. And I know that ratings I'm sure I'll get questions about ratings, and I know it's a frustration because we're not coming out so regularly at the moment to update your ratings. We're looking at easier ways of working with us, so that the frustrations that some of you have about submitting notifications or letting us know things, applications for registration when you become registered managers, we're looking at making that a lot more easy to do. And also making sure that the responses you get are accurate and are proportionate to what you're telling us. Next slide, please. Okay, so site visits, which are inspections, as you will kind of understand them, remain vital in our assessments about the quality of a service, and they are essential for us to observe care, but they're not the only way to assess quality. So, well, somebody not on mute. So you will know during the pandemic that we very much went to a different way of inspecting, where we'll spend as little time as possible on site and ask you as managers for a lot more information and make phone calls to staff and to relatives where possible, rather than being in the home and taking up your time and increasing the chance for infection. So we are moving forward. I mean, during the pandemic, we've had, probably like yourselves, we've all been forced into different ways of working. And actually, some of those ways of working have proved to be really positive, and we will keep moving forward. Some haven't worked. They have worked in the pandemic, but they don't work long term. So we will not keep those. And I'm sure that's the same for yourself. So we will look at all our regulatory methods and to support robust and proportionate decision making. We really, really want people to tell us about care, but we want people to tell us about positive care. People are pretty quick to tell us about negative care and their views, and whether that's staff, yourselves, relatives, service users. However, not many people tell us about good care. And actually, we want, we welcome people to tell us, actually, we've had a really good experience with this. So we're looking at, we hope that we have supportive and constructive relationships with providers. That is always what we would aim for. However, we are the regulator, and so I completely understand that if we rate you inadequate, then you're probably not going to be, we're not going to be your favourite people. But we would always aim to work in a professional way, and we also are very aware that you are constantly getting requests for information from a variety of ways, so that we're always looking with the CCG and the local authority about how we can reduce that. And I think the capacity tracker is an example of that. So we have access to that. The capacity tracker feeds into our data that we hold about all of your services, and that has really reduced us requesting for some information during the pandemic. Next slide, please, Christian. So always our focus is on safety, and we're encouraging a real safety improvement where people are open about when things go wrong, so that lessons can be learned. Because the worst thing when something goes wrong is that someone tries to cover it up, and then appropriate action isn't necessarily taken for the person to whom harm came, and also none of us learn anything from that. So safety is always at the heart of what we do. And in terms of our current inspection programme, we're prioritising inspections where we have concerns about risk, and that's about risk to people's safety. So we will act quickly where improvement takes too long or where change isn't sustainable. So we know that, you know, the absolutely vast majority of care services really want to do a good job, are doing a good job. They're doing, you know, working really hard to do a good job. Unfortunately, in Suffolk, the same as anywhere else in the country, there are occasions when a service just isn't able to make that improvement, and the reasons for that can be many and varied. But it's right as a regulator that where that occurs, if people are at risk, then we need to take action to prevent that from happening. We're really focusing on open and honest cultures, and really taking a look at much closer look at services where we feel there's a closed culture, where we don't get any information about services, where there may be very limited relatives visiting, where when we talk to staff, they're like, no, I wouldn't tell anybody if I saw anything wrong, because, you know, the manager doesn't encourage us to do that, or things like that. That doesn't happen very often, but that's, you know, they're the kind of areas that we're really concerned about, and moving forward they will remain those areas we are concerned about. We need your staff to feel, and yourselves to feel confident that we'll listen and act on your concerns. And often people don't understand that, you know, they raise a concern with us, it's really important to them. Absolutely, we never ignore information. However, that doesn't mean we're going to go straight out and do an inspection. Doesn't mean we're doing nothing, though. And we need service users to feel that they are influencing the care that they receive. Next slide, please, Christian. So, okay, so in terms of adult social care, our priority for year one, so this is year one as we work towards the new way of working. So we're developing how we monitor risk and testing a new assessment framework. So some of you will have had an ESF call, you will have had an inspection, like I mentioned earlier, where we're in the home or in your service for a much quicker period of time. If you're a domiciliary care agency, you may have been part of our pilot inspections where we did those without a visit to your office, but could still rate you. And we are now moving on to what you might hear as the direct monitoring activity, or DMA. We're trying to do away with acronyms, but they're always a shorthand. So it's a direct monitoring activity. So what we do is we're using our insight from the work that the things that we've tried over the last few months during the pandemic, that we were forced into a different way of working. We're taking the positives of those. We're taking everything that we do. I mean, hopefully all of you are signed up to the CQC providers newsletter. You can just go on our website and request that if you're not. But in that, there will always be information about any consultations that we're running. We also have a whole engagement team that engage with service users, their relatives, and with providers about any changes to the way that we're working. We're looking at a new provider portal that supposedly will be easier for you all to send us information, and also a mobile friendly website, because we understand that our website isn't as great with mobile. So we're also exploring our approach to looking at how local systems understand the needs of people in their area. So we have regular information sharing with the CCGs and the local authority. Next slide, please. So currently, how we are working, and again, this is part of our kind of testing phase of what's working and what's not. So we're interested in hearing views from yourselves. One of the inspectors did a direct monitoring activity call with a manager this week, and the manager has sent in really helpful feedback. It's very positive feedback, but it's still helpful, and we want to hear all feedback because we need to know what your views are. So what happens is that all of the data and information we hold about all of your services is reviewed on a monthly basis. That's not a person review, that's a kind of analytical review that's done, and internally we give the services a banding. Now, that before someone says, can I know what my banding is? No, because that's our internal kind of risk base. We've over the years we've called them all sorts of things, but currently they're the services are put into bands. So for band 1, that services, that's where our information review hasn't found any evidence that we need to go back at. You're rated good, outstanding, we've got no concerns, we've not got any ongoing safeguardings, then we're going to publish a statement on our website to say that we've got no reason to believe that this rating is not accurate. We're not carrying out an inspection. In band 2, which is where our information review suggests we may need to review the quality of care, then myself and the inspectors will look at those services, we will prioritise those, and that's where we'll carry out a direct monitoring, what we're calling direct monitoring. So that will include a call with yourselves. You will get notice of that. It's not an inspection. We can't carry out, we can't change the rating from that. Basically, it will be because maybe your service is in band 2 because we've had some safeguardings or some whistleblowing, or you haven't had a registered manager for a while. So we will do the direct monitoring, which the inspector will review all of the information we hold about your service. They'll contact the local authority contracts team, the CCG, Health Watch, anybody else that has involvement with your service like that to get information. They'll have a call with you as the provider. It will be a planned call. You can agree the time. It will likely to be a video call, and we will assess the information that we have. Most of the time, we will be satisfied with that information and we will not need to take any other action. If we have concerns during that time, we may also then decide the outcome of that may be that we actually do need to come and do an inspection. Something is suggesting that we need to observe care, we need to observe the building if people are raising concerns with us, and that we might need to change the rating because the rating may not be accurate. And that could be both ways. And part of our direct monitoring activity will include talking to service users or relatives. So we will ask you for the information for us to do that, like we do in an inspection. I will have questions at the end if I'm just kind of going through the whole presentation first, if that's okay. Christian, next one, please. So I said the monitoring review, the direct monitoring activity won't change ratings. And to ensure that we're making consistent and robust decisions, we are doing a sample of the band 1 services. The band 1 services are where we've decided, actually, we've got no concerns about this service. It's rated good or outstanding. We have no reason to think that it's any different. We're not going to do an inspection. However, we are going to do a random sampling of those to make sure, because some of those services will not have been inspected for 2 to 3 years. So we will be doing a sample of those just to make sure that we've got our thoughts right about that plan. Next slide, please. So this just really tells you about what will go on the website for the band 1 services. So if you suddenly see on our website that that's what it says against your service, we reviewed the information and data that we held about your service on whatever date. We've not found evidence. We need to reassess. We'll continue to monitor information about your service. That means you're band 1. We're not coming out to inspect or do any direct monitoring activity. That can change at any time if we get any concerns. And it doesn't amount to an assessment of the rating legally, therefore we can't change the rating. Next slide, please. I thought it might be just helpful to just talk a bit about the legislation around vaccinations, because I thought you might have some questions about this. So just a few facts. So the key dates to bear in mind are 22nd of July, which has been and gone. The next key date is the 16th of September, which means is the last date for care home workers to get their first dose of the vaccine. So they're fully vaccinated by the time the regulations come into force on the 11th of November. Next slide, please. Thank you. So the legislation around vaccinations is currently only for care homes and nursing homes registered with CQC. So that is for any type of care, service user bands. So whether you're a care home for older people or for people living with a learning disability, if you're a care home, nursing home registered with us, then that legislation applies. It doesn't apply to housing with care. It doesn't apply to supported living or domiciliary care agencies at the moment. Whether the government extend the consultation and extend the legislation, we don't know. So the requirement forms part of the fundamental standards, and legally CQC have been tasked with monitoring and enforcing this legislation. We're not going to begin monitoring this until it becomes a duty in November. However, inspectors will be starting to ask you what you're doing to ensure that you can meet this legislation from the 11th of November. So they will be, when they have contact, they won't contact everybody, but if they're having contact with you anyway, they might start to ask you questions about, have you got any staff, how many, what are you doing to make sure that that the legislation will be met. And we're going to continue to use our existing assessment and enforcement policies and take a proportionate approach. We're not coming up with a whole new set of inspections just to monitor that. Next slide, please. So some of the examples of how we'll monitor it is at registration. Any manager applying to be a fit person will have to be able to evidence that they've had the vaccination, and that they have a clear understanding of their responsibilities and an idea of how they're going to have a robust governance system. So during inspection, we won't be asking to see proof that your staff have all had. What we will be saying is, show us your system and where's your records that you have checked everybody, and tell us what the system is about visiting professionals. So we have been doing some work with myself. I've been talking to the CCG and local authority about their awareness that their staff need to be meeting this, that you will need to make sure that that those visiting professionals, district nurses, GPs, they're all going to need to meet that criteria, and inspectors, obviously. So there is nobody in the Suffolk team who hasn't, at the moment, and they're currently working in the Suffolk team, who hasn't had 2 vaccinations. But if we do have inspectors, then obviously CQC, like yourselves, is having to look at how we look at what people are doing, and we might choose to add a question to the provider information return about vaccinations, but that's not clear. But just to be really clear, I hope that you've all kind of looked at the guidance. If you have a look on our website, if you haven't seen the guidance, is very specific about who. So this is everybody that comes in your home. If your provider doesn't have 2 vaccinations, don't let them in the home. If you're, workmen coming in, if they're doing stuff outside, that's different. But if they're coming in the home, if a district nurse, the inspector, and then there is all sorts of information in the guidance about relatives and about visiting people who are at end of life. So there are some exemptions. I think the next slide shouldn't say legislation. Please don't send me all the questions about vaccinations. I forgot to take that title off, but that's just my details if anybody wants to send me any questions afterwards, but not specifically about vaccinations. So that's it, Christian. Thank you. Has anyone got any questions?
It'd be good if anyone's got any questions to come put their cameras on and come off of mute.
Yeah.
There's only a few of us, so we should be able to manage that quite well.
You can ask me about anything to do with CQC. I'm happy. While you've got me here, feel free to ask me a question. I've never before been in a managers meeting where they didn't have loads of questions.
They seem to be quite shy in this one, though, sometimes.
I'm happy to answer any questions other than about individual inspectors, of course, but we have a process for that. But yeah.
Can I just ask a question about ratings?
Yeah, Anne, if you want to go, then Karen.
So I understand, obviously, what you've just explained. Is there an opportunity at any point, or is it very random for anyone that's good or outstanding to get a higher rating? How will that come about?
We're not sure how that's going to work moving forward. At the moment, we're just identifying risk. We are mainly inspecting for risk. There are occasions where, if a service is, which doesn't answer your question about good and outstanding, but if you're inadequate or requires improvement, and the information is that, well, inadequate, we would go back more regularly. But say, for example, requires improvement, and we have information from local authority, from yourselves, that improvements have been made, then that will factor into our thinking about prioritising inspection. But currently we have so much risk that we are The pandemic has caused all sorts of issues for services. Suffolk outstanding services and are lower than national average inadequate services, and that is not the case now. I suspect that the local authority and CCG are very supportive, and their skills for care. There's lots of and care development east. Sorry, I should have said you first, but there's lots of support in Suffolk. I've worked in other local authorities, and it isn't always the same. There's lots of support, and I think when that support was removed last year, the physical, people going in and seeing what was happening and offering support at an early stage, possibly for me that. There can't be a coincidence that some of the and all the other pressures obviously on top of that for yourselves.
Okay, thank you.
So I'm not saying it's impossible, but I think it's unlikely we're going to go to a good service and rate it outstanding just because we're told really marvellous things about it. If it's part of the pilot, then we might. But in the next phase of our inspections, and I'm talking about the next few months, it's unlikely.
Okay, thank you.
Karen?
And we know that's
rating.
Sorry. No, I'm going to apologise.
Karen?
Yeah, I was just going to ask, with the ratings, will that still happen after you do the kind of old style inspection? Is that when the ratings are changed or looked at all?
Now we change ratings when we do a focused or a comprehensive inspection.
Yeah.
So currently, before comprehensive, looking at all 5 key questions and looking at every Chloe within those was the normal, if you like, type of inspection. We've moved away from doing that, mainly because actually we wanted to not be on site for very long, because we didn't want to add to the pressures of the manager. We didn't want to take up too much time, and we just literally didn't want to be in the home for too long in terms of obviously infection prevention and control. We've been doing mainly focused inspections, so that would look at safe and well led. And to be honest, if you look at the Chloes that are covered in safe and well led, you don't need to do much more to make it a 5 key question, but that's where our focus is on the safety, which covers staffing, risk, medicines, those kind of issues, and well led, because it's about the governance. A service is unlikely to be providing good quality care if the governance systems and the management is poor. That's where we're focused. So we do still do 5 key questions if we've got concerns right across the board. We will also do it, say for example, we've got a service that's rated RI in 5 key questions. We need to come and do all 5, because if we only came and did safe and well led, even if they went to good, it would still be rated RI overall, because 2 RIs, it would still be 3 RIs would trump the 2 good, and that isn't fair on a provider and manager. So we would, when the inspectors are planning, they would look at that. Sometimes we do targeted inspections. So if we had some real concerns about, say for example, medicines, we could just come and do targeted, look at medicines, not look at any other Chloes, and that wouldn't change the rating. Whereas the focus, when we do safe and well led and the 5 key questions, does.
Okay, so the focus inspections will still stay the same, and the key lines of inquiries, those Chloes will remain the same as far as you know. Yeah.
The legislation hasn't changed around our Chloes and the fundamental standards, and so a focus. Pretty much every one of our inspections, we can change the ratings only if we come and do targeted. Like when we came and did the IPC ones, last year when the Department of Health asked us to do a high number across the country of IPC, we couldn't change the ratings for those.
Okay, thank you.
Lella, I've got a question. I just wondered, you mentioned that the changes in the way the places are regulated at the moment in Suffolk. And so what in general are the big safety and risks that CQC is currently worried about at the moment? What are you seeing? Is there a trend?
Yeah, I would say now in inspections, we're seeing over the last few months, we've seen some, not many, but where we've got concerns, a kind of just a dropping off of the attention to IPC matters. So, in the height of the pandemic, we rarely found services. We did find 1 or 2, but we rarely found services where people weren't really on it. And then, I've been reading reports the last few months about going and staff not wearing masks properly, and just kind of, I think, as the urgency of it, and also people are probably a bit tired of it, and they're starting to go about their normal lives outside of work. So then it becomes harder, doesn't it, to remember that actually we're still working with vulnerable people. So staffing, we know that staffing is a massive issue for you all. You know, we have regular meetings with local authority CCG. We know that staffing is a big issue, and we know that for some of you that vaccination issue will impact some of you more than others, but we know that agencies aren't managing to provide staff when your own staff are off. I mean, and this time of year is particularly bad, and you have people pinged, and then you've got everybody on holiday, and it's particularly difficult. So I think staffing is an issue, but you know, the governance of things, I think something like a pandemic just identified where maybe some services were kind of okay on the day-to-day, but you know, you bring something in, and if actually the governance and management of the home wasn't great, then actually trying to then manage and keep ensuring you've got good quality care, you're keeping your staff happy, all of those things you have to do, you know, it requires a lot of skills, doesn't it?
Yeah, I mean, I know that I'm sort of on a few groups on Facebook that are registered managers and things, and there's some very stressed managers out there that are struggling to keep up with all the changes.
Absolutely.
You know, so yeah, no, thank you for answering that. Has anyone else got any questions? Oh, you might have got away lightly here, Lella.
Well, you've got my email address, so if anyone wants to ask me a question that doesn't want to be brave enough and come on camera, they can do that, can't they? So, but thank you very much for inviting me.
Thanks a lot.
And I will. I'm going to leave you because I'll go on to my next meeting. But thanks very much. And if anyone's got any general queries, please do contact me. I'm always happy for that. Thanks
lovely.
a lot.
Thank you.
Thanks a lot.
Very helpful.
Bye.
Thank you.
Bye.
Bye. But you're going to start talking now, aren't you? Now the inspector's gone, I can tell. Okay. Karen, do you want to do your skills for care section?
Oh yeah, thank you. Are you okay sharing this? Oh yeah, thank you, Christian. So really, what I did for today was picked out kind of all of the CQC related stuff, related support that we have. So the first one, we've got an up and coming webinar, kind of similar to, or kind of supporting what Lila was saying. This webinar is on the 5th of October, and it's done in partnership with CQC. So again, looking at the monitoring and inspection and support, so that really complements it. So I think it's good that you've kind of got a quick look here first, but also an opportunity in October to join the webinar. So we anticipate this to be booked up fairly quick. So if you're interested, book up, register for your place on the link. If you don't make it, it'll be on our website. It's recorded on our website, so you can view it at your leisure. The next webinar as well that's up and coming is about recovery, reflection and moving forward. So this is a bit closer. This is in September on the 23rd. So looking at stories, tips and ideas, and reflecting on the past kind of 18 months during the pandemic on how we can move kind of forward together. And the link is there to book and register for your place there. So these webinars support kind of a suite of webinars that we have on our website. On the next slide, it will kind of give you an overview of all the other resources that we have on webinars. So the most recent ones that have been recorded are on the website. Regulatory perspective. I cannot say regulatory very well ever. I need to get my head around that. I get my tongue around that. So looking at medication. So the most recent ones are there and on our website and recorded for you to have a look at. And these are really just 30 minutes. They're not kind of long or arduous. They're really kind of a quick snapshot. So 30 minutes isn't as, you know, as long as it need be, as it could be really. Then just to tell you, excuse me, that we've launched our new strategy. So we've got a new 3-year strategy at Skills for Care. So if you're interested in seeing kind of more about what we do, how we're going to do it, what we're about, then there's a link to view there. Essentially, there's 4 key areas. So looking at workforce capacity, capability, supporting culture and diversity, and improving social care system. It's really, really easy to view the strategy. We've been talking about it for a while internally and kind of going out to stakeholders. So it's really useful to have that direction, really. And the next slide is just a couple of links that you might want to signpost some of your carers or some of the people you come in contact with around financial support and advice for adult social care workers. We have the Care Workers Charity. So you probably would have heard about this, and the CEO there is usually happy to come and talk. I'm not sure if she's come to this meeting. Catriona, I think her name is. But if ever in the future you wanted her to come along and talk, I'm sure she would. And then some other links there that can offer support, financial support, really. The next slide is the Eastern Region Deputy Manager Network. So I've mentioned these before. So we've opened the network for the whole of the Eastern Region, just to really grow the network and give lots of opportunity for deputies or senior managers, senior carers, anyone in that role, to come together and support each other, share their challenges, support each other on a WhatsApp group and come together a couple of times just to kind of support each other. So the next meeting is on the 9th of September, and the focus on that one is around communication inside and out. So that I'm looking forward to that. So I'll be on that one. And then the rest of the slides, as I said, is around kind of the offer that we have around CQC support. One of the first things I just wanted to remind you of is that we have a refreshed guide around recommendations for CQC providers. On the next slide, it shows you just kind of when you click on the link, what you'll be able to see. So lots of tips and resources on how that can help you with your CQC inspections. So if you click on the next slide, please, Christian, that just gives you kind of an overview. So we've recently updated it. And on the next slide, it gives you the contents. So you can see, you can click on any of these contents. So if you're opening a new care organisation, some resources around how to support with CQC, supporting managers, preparing for inspection, delivering good and outstanding care, how to improve your service and connecting with others. So on each of those tabs, we'll give you resources and guides and information for all of those. The next kind of offer that we have around providing CQC support is the Good and Outstanding Care Guide. So these resources share best practice and looking at what other organisations are doing to achieve good and outstanding care. So it's kind of sharing tips, seeing what other people are doing, whether that's something that you could take on or adapt or tweak, or just useful for your service if you wanted to include that. So if you click on the next slide, Christian, thank you. It just gives you the front page there, the online edition, and then the contents. So it's really written around the Chloes. So you can click on each one of those Chloes and it will tell you resources and top tips around being safe, effective, caring, responsive and well-led. There's also some case studies there as well to see what people are doing. So that's really useful. This is the other kind of support area that I thought was useful. So this is in conjunction with Skills for Care, Sky and NICE. So this is a Care Improvement Works. If you just Googled Care Improvement Works, you'd get this front page. And then it's broken down into each of the Chloes. So if you clicked on well-led, so I think Lella was talking about, they'll always look at well-led. So on the next slide, this is what you'll see if you clicked on well-led. It will give you all of these indicators and criteria of what's under well-led. And then once you click on each of those, it'll give you all the resources. So for the first one, for the number one in well-led, if you click on that, it'll give you all the resources we have at Skills for Care, all the resources from NICE and from Sky around each one of those different criteria. So it's kind of all combined together under the Chloes. So it's really useful. So that's the Care Improvement Works, and that's been up and running a while. So it's just really a reminder that we've got that. This is the Moving Up programme. So there is funding now available for the Moving Up programme, and this is aimed at Black, Asian and minority ethnic leaders. So it supports managers. You can read the slide there, but there's some more resources. Clicking on the link there for you to sign up and there's funding for that course. And just kind of nearly finally, there's still funding for the rapid induction training. So this is still free. Induction training is available for your staff through a number of our endorsed providers. So the link is there for you to find out who they are and how you go about attending those for your staff. And then the last slide is just my contact details. If there's any questions, there's a link to sign up for our fortnightly e-news. If there's any questions, drop me an email. And that's it.
Lovely, thank you. Some really useful items there, Karen, and really good that it links in with the CQC talk we've had as well. So thank you. Has anyone got any questions for Karen? No, that's fine. Obviously, the links will be sent out to you anyway. So Karen Large, thank you for joining us, Karen. We were a bit delayed because we had some IT gremlins at the beginning, so hopefully you've got a little bit of time still to have a chat with us. That'd be really helpful.
Thank you. We've had similar gremlins today in our IT. So thank you very much for allowing me to come along to your meeting. I'm Karen Large. I'm the General Manager for Community Nursing and Therapy in Ipswich and East Suffolk. And I'm mainly responsible for all of our rural teams, so Felixstowe, Woodbridge, Aldborough, Stowmarket and Hadley patches, but work closely with my opposite who covers Ipswich. The reason I wanted to come and talk to you today was just to talk through, probably about 2 years ago, we started a project with one of the care homes in Ipswich around insulin delegation for the residents who had daily insulin. And we've now been able to roll that out to 11 of the care homes within Ipswich and East Suffolk. We are seeing quite an increased rise in the number of patients that we're being asked to see to administer insulin to. And we wanted to come and talk to you to see whether there is an appetite for us to come and do some work with you in your care homes to enable you to be able to administer the insulin on a daily basis to those residents that need it. We work very closely with the CCG and we have a care homes initiative team that are based here with us in Ipswich, who would be able to come out and do that training, working very closely with our district nurses. And we also ensure that we monitor on a regular basis to make sure that everyone's happy with their skills, the patients haven't changed, and if there's any questions that people need to ask us. So it was just really, I'm afraid I've got a PowerPoint, apologies, but it was just really to come and kind of share that with you to see whether anybody would like to look into that in more detail with us.
So is there anyone that obviously is in a care home setting that wants to respond to that at all? Unfortunately, I'm in domiciliary, so Sharon, do you, I don't know if you can hear and see us now you're on your mobile, do you have any involvement in this already?
No, but we would like to have some training. That would be brilliant.
I think the pandemic enabled us to move it all forward quite quickly. We worked very collaboratively with a lot of our care homes in some of those lower level nursing interventions that we provide, obviously to reduce that footfall into the care home. Hence why we've now got 11, which has reduced our district nurse visit by over 300 visits each month. So it's something that we're really very keen to work with, and also with our Dom Care agency colleagues as well. If they are going in regularly to a client, there's no reason why we can't offer that same training to domiciliary carers as well, if that's something they would be interested in. But I know sometimes there are restrictions around insurance or CQC registration that might mean that that's not possible.
Definitely something we could talk about, though. It'd be interesting. So because we do support quite a few people that do have or need to have their sugars regularly monitored. So
yes, yeah. Okay, that's really helpful. And what would be the best way to take this forward? Do you want, Christian kindly invited me, if I share our details for you to contact me and we can start that process?
Yeah, what we could do, Karen, is we can put them up on the Care Development East website, but we'll also share it through sort of allied to this. We have a sort of WhatsApp managers group that's got about 64 people on there.
Okay.
So we can also communicate via that channel as well. So there's lots of different ways. So if there's anything that comes out that could be useful to providers, we can get that out on a weekly basis or on the website or through the WhatsApp group as well.
Lovely. That would be really helpful. Okay. Could I be very cheeky and ask a second question that's not related to insulin very quickly? Because I just caught the end of the CQC presentation and the work that's happening around vaccinations, and we're already on that case. We want to get ahead of the curve before November. But I'm just wondering if any thought has been given to how our health professionals will be monitored. I know that we need to provide our evidence of our vaccinations and proof of identity, but I'm just wondering whether the homes would then keep that record so we don't have to do that every day we come in, or kind of how it might be managed, just so that I can prepare the teams.
That's an interesting question, because that was raised on, I don't know if you were there on Tuesday at the Care Cell meeting, Karen, where it came up, and I think it was what the GP, whose regular attender Ben Solway was saying. He was saying that, I mean, you've obviously got the NHS app is proof of vaccination. He said the card is not proof of vaccination, didn't he? You can also get certificate of vaccination as well. You can apply for that online, and that is proof. But it's an interesting one about how you, rather than having that constant checking all the time, how you keep that information on record, and where you would keep the information as well in a secure and safe manner. So I don't know if anyone's got a genius suggestion. I mean, to my mind, I mean, the app, I've got the NHS app loaded on my phone, and when we start doing events in the autumn, we'll be asking for people to use that as proof of double vaccination. But I don't know if other providers have given this any thought at the moment.
No.
I wonder. I mean, for us, it's slightly different in domiciliary care, but I mean, I wonder whether we're just going to all get used to having to show our phones and that there's my certificate on my NHS app.
I think that's a good point, because we visit care homes, don't we? To visit people in care homes. Although we're domiciliary, we often go in to visit or are asked to go in and see someone that's wanting to go home. So I think it's something we've got to get used to doing.
I think because we often have the same nurses, we try to align them to care homes as much as we can, and I would imagine after 4 or 5 times the nurse showing her ID, they might, we might start to realize, actually, we've seen that ID and you can come in. But we just wanted to check whether you wanted some form of official certification from us.
I mean, sorry, I was going to say, Joanna, I mean, it's just an idea that's popped into my head, that you can apply to get an official certificate of vaccination. And I suppose that, for example, if one of your nurses was going in, they bring a copy of the certificate, or they bring the original of the certificate, the home then copies that and puts that on record, and then it's there for good then. No,
so
I don't know whether
that was just what I was going to say. If I was working in a nursing home, that's what I would consider. I would ask them to provide us with their certification, the same way the airports do and everyone else, and then we would hold it on file. And we would know then that I used to work in a nursing home, so I would be inclined to say that's what I would have done in that situation. So, and once you've got that evidence, it's there each time. Sorry, Sharon, did you?
I think I'd start a chart, because there's got to be trust. And once you've seen it, you put a tick against the name and a signature. Otherwise, you're going to have paperwork coming out your ears, and where are you going to store it?
Yeah, and then we've got to add that we're all going to be asked to do a booster.
Yes, and the flu jab.
And the flu jab, exactly.
Okay, lovely. Thank you very much for that. That's really helpful. Is there any other questions about the insulin delegation? No.
No.
Okay, lovely.
Thank
Thank you.
you.
And
Thank
thank you
you.
again for allowing me to come to your meeting.
No.
Thanks
you're
for
welcome.
coming, Karen. Thank you.
Okay. Have a good weekend, everyone.
Thank you.
Bye.
Bye. Okay.
So I think, well, everyone keeps disappearing the minute that, apart from Karen, who Karen always stays. She's very good, but everyone else disappears. So is there anything anybody else wanted to talk about before we finish for this afternoon? Christian, go for it.
Yes, there is a virtual hand thing, but it's not very quick on Zoom. So I just do the real thing. It's like put my hand up. I just wanted to mention the Care Awards, Suffolk Care Awards, in case any of you haven't got your nominations in it yet. I would say to you, why not? Because the deadline is fast approaching. Thanks very much, Joanna, for the entries that came through today.
Oh, I didn't put them through, so I don't know.
Just to say that it's not too late to enter the awards. There's plenty of categories. The official deadline is the 31st of August, but I might allow some leeway there if you're still putting your entries together. I'm interested, actually, from the providers who are still on the call, that I just wanted to reassure you that in terms of the judging process this year, we will not be sending people out to visit sites or into sort of premises. And a lot of the judging will be done using things like this, using Zoom, to really sort of minimize the having people trooping off all over the county, and keeping in mind things like infection control. And then when we get to the big event itself on the 11th of November, it's funny, we were talking about vaccinations and proof of vaccination. All of our events from October onwards, you would have to bring your phone with you and show your COVID vaccination record, and the venue as well. We're making sure it's as COVID safe as it can possibly be. So I don't know if anybody had got any questions or concerns at this point about the actual event or the judging process. We've had some phone calls this week about the how will the judging work, and as I say, most of it's being done online, and we've also simplified the process this year as well, so it's a little bit less like an inspection. So I just wanted to give you a gentle reminder about that. And anyone got any questions at all about the awards, or comments or concerns?
Oh,
Yeah,
Karen.
Who's the guest presenter?
Who's the guest presenter? That's a loaded question, because I think you know the answer to that.
I do. I just thought it would be. I was just teeing you up for
Yes,
it.
it's just a reminder, just to remind you that this year's awards will be hosted by Sean Williamson, and people will like say, who's Sean Williamson? Barry from EastEnders will be presenting the yeah, all of a sudden I can see Anne sort of, yes. Barry from EastEnders. So I can assure you that he did the Norfolk Care Awards and was very good there. So we've borrowed him. We've pinched the idea, but it should be a very good evening. And the main purpose of the whole event is that with the last 18 months or so, it's to put a spotlight on the sector and just to recognise everybody's efforts. So I think that Sean, I mustn't call him Barry, because otherwise on the night I'll make a mistake. Sean will be ideal as a host for that evening. So all right. Oh, and the other thing as well, sometimes Prima comes along to these, is that the Suffolk Association of Independent Care Providers have got their conference on the 14th of October. They've got a very good lineup of speakers, and I know that you can still get tickets. I think their website is saicp.org.uk, but that's one that's well worth looking at. I say, really good lineup of speakers, and we'll be there as well exhibiting. So, you know, what's not to like? Right, I'll shut up now, Joanna.
Oh, lovely. Has anyone else got anything? No, so it just leaves me to say thank you very much to everyone for coming. Thank you, Christian, for organising, and Karen for speaking today. I hope you have a good few weeks before we meet again.
Thanks a lot.
Take care, everyone.
Thank
Thanks.
you.
Bye.
Bye.
Bye.